Assalamu alaikum everyone. Today I will demonstrate you a typical thoracic vertebra. Second to eight thoracic vertebra are typical in nature because they bear common features. So it is typical because it has two costal demifacet on each side of its body. So you hold this in anatomical position. The vertebral body lies anteriorly, vertebral arch lies posteriorly, spinous process lies downwards and backwards. The vertebral body is a modified long bone because it has outer compact bone and inner spongy bone and it lies horizontally. Spinous process, transverse process and superior inferior articular process makes the vertebral arch a irregular type of bone. So vertebral body is almost heart shaped. The anteroposterior diameter is less than the transverse diameter. The vertebral foramen is almost circular in shape. The vertebral body is connected to the vertebral arch by a thick pedicle. The pedicle shows superior in vertebral notch and inferior vertebral notch. The vertebral arch has superior articular facet in the superior articular process directed posteriorly and inferior articular facet in the inferior articular process directed anteriorly. Two transverse processes directed posterolaterally and the spinous process directed downwards and backwards. The vertebral body shows four surfaces: superior surface, inferior surface, anterior surface, and posterior surface. The transverse process is connected to the spinous process by a lamina. So the ligaments of a vertebral body and arch. The anterior longitudinal ligament is corresponding with the anterior surface of the vertebral body. Posterior longitudinal ligament is corresponding with the posterior surface of the vertebral body. The ligamentum flava is corresponding with the anterior aspect of the lamina. There are two ligamentum flavum on each side of anterior aspect of the lamina. The supraspinous ligament with superior vertebral spinous process, infraspinous ligament with inferior vertebral spinous process. There are ligaments in the transverse process, anterior, posterior, and lateral costotransverse ligament, which is joined with the corresponding rib. So, joints of vertebra: the superior articular facet with upper inferior articular facet will show you a facet joint or zygapophyseal joint, which is a plain type of synovial joint. It provides sliding and gliding movements. And similar type of facet joint will take place in between the inferior articular facet of this vertebra with lower vertebra's superior articular facet. So this converts the vertebral notches of both vertebrae into a vertebral foramen, which passes the spinal nerve, corresponding spinal nerve. The vertebral foramen will passes the spinal cord with meninges and vertebral venous plexus with it. And the upper costal demifacet will join the lower articular facet of corresponding rib like this. So this is a plain type of synovial joint like this. Okay. The tubercle present in the neck of the rib will have a joint with the transverse process like this. So this is also a plain type of synovial joint. If I show you a typical vertebra, thoracic vertebra, it has a full costal facet, not a demifacet, a full costal facet. So you can differentiate a typical atypical vertebra in the basis of demifacet, costal demifacet. Thank you all.